Following the primary assessment, where we conducted an expedited physical examination to identify and address any immediate life-threatening conditions, we now transition to the secondary assessment. This phase entails a comprehensive and detailed physical examination to uncover any injuries or illnesses that we may not have been immediately apparent. As we begin the secondary assessment, it is crucial to systematically revisit each aspect of the patient's condition with increased scrutiny. You may refer to the workflow diagram provided on pages 8 and 9 for a more detailed understanding. It is vital to maintain clear communication with the patient throughout this process, ensuring they are informed about the procedures being performed regardless of their level of consciousness. Write all your observations in the subjective and objective portions of the SOAP note you're maintaining on the patient. We start at the head of the patient. During the examination of the head, we will carefully palpate the skull to identify any abnormalities such as soft spots or indications of bone friction. It is also important to observe the patient's response to identify any discomfort. Additionally, inspect for battle sign, bruising behind the ears, and raccoon eyes, bruising around the eyes, which may indicate a traumatic brain injury. Notice any cerebral spinal fluid leaking from the ears, eyes, or nose, characterized by its clear, pearlescent appearance, and manage it appropriately without obstructing the flow. For the face, proceed to examine the patient's cheekbones and jaw for fractures by applying gentle pressure and assessing mobility. Listen for the patient's moaning or complaining of pain. For the neck, in evaluating the neck, place close attention to the trachea's position, as lateral displacement may signal underlying issues requiring immediate attention by emergency medical services. Observing the veins in the neck for distension can provide insights into potential thoracic or cardiac conditions. When examining the torso, ensure to conduct the procedure with sensitivity and respect, particularly in gender-sensitive areas. Shoulders, push on the shoulder bones. Walk your fingers along the collarbone to feel for broken bones. Sternum, push on the sternum. It should be solid. Now for the ribs, push diagonally and inward. Now we'll perform an abdominal exam. Divide the abdomen into 4 quadrants with the belly button in the middle of the crosshairs. The quadrants are identified as the right upper quadrant, right lower quadrant, left upper quadrant, and left lower quadrant. Remember, your right is the patient's left. For each quadrant, push in slowly and release quickly. Note if the patient reports pain when you push in or when you release. Note any observations on the SOAP note. Now our attention shifts to the pelvis, where stability is assessed. Place your thumbs on the pelvic crest and push inward. The pelvis should not move. In case of instability, utilize a long sleeve shirt, jacket, or shemagh to create and tie a pelvic binder to immobilize the area and reduce the risk of further injury. And we'll check again for deformities, broken bones. Legs, ankles, and feet, push down on the bones and feel for broken bones. Or if the patient complains of pain, expose any areas of concern and notate what you find on the SOAP note. We'll do the same examination for the arms, wrists, and hands and note anything we find. Now for the joints, raise and bend at the joints the right arm, right leg, left arm, left leg. Note any limits to the movement and if the patient complains of pain. A careful log row should be performed to examine the spine for signs of injury, with special attention to the patient's feedback and any physical indicators of trauma. Look once again for any signs of bleeding. Treat any bleeding you find. Note the anomalies on the SOAP note. Roll the patient back to the pad. The assessment concludes with evaluating sensation, circulation, and movement in the extremities, ensuring the patient's neurological and circulatory functions are intact. First, we assess movement. Have the patient push both feet against your hands and ask the patient to squeeze your fingers. Sensation. Tap on each of the patient's feet and ask the patient what foot you're tapping on. Do the same for both of the patient's hands, tapping on a finger on each hand and ask the patient what finger you are tapping on. Finally, we check for circulation. We'll check for a radial pulse in both arms. Note if there is any variation between the patient's arms. We'll also check for a pedal pulse in both of the patient's feet. You can locate that pedal pulse on the artery that runs halfway between the heel and the ankle bone. First, let the patient know you'll be checking their pulse by their ankle. This helps them stay calm and still. The person can be sitting down or lying flat. Their legs should be relaxed. You're aiming to find the pulse just behind the bump on the inner side of the ankle. Slide your fingers into the space between this bump and the Achilles tendon. That's the big tendon that runs down the back of the ankle. Place the tips of your index and middle fingers, not your thumb as it has its own pulse, gently in that space. Once you feel the spot, press lightly. You should start to feel the heartbeat under your fingers. If it's not clear at first, adjust your pressure or move your fingers around a bit until you find it. Notice how the pulse beats. It should be steady and strong enough to feel easily. Record in the SOAP note how fast the pulse was, how regular it was, and how strong it felt. If anything seemed off or if you had trouble finding the pulse, make a note of that too. Tell the person that you're finished checking their pulse. This pulse check is a handy way to make sure blood is flowing well into the lower leg and foot. Now, an alternate method to check for circulation in the extremities is to check for capillary refill under the finger or thumbnails of the patient. Checking capillary refill is a simple way to get an idea of how well the blood is circulating through the body, especially to the extremities like fingers and toes. It's something that anyone can do without needing any special equipment. Here's how you can do it and why it's helpful. You're going to press on a nail bed, so decide whether you're going to be checking a finger or a toe. Press gently on the nail bed with your thumb or finger. You want to apply enough pressure to make the nail bed turn white. This means that you push the blood out of the capillaries. Let go and watch how quickly color returns to the nail bed. This is your capillary refill time. The color should return pretty quickly, typically within 2 seconds. This time frame is a good sign that blood circulation is normal in the extremity. If the capillary refill time is longer than 2 seconds, it might suggest that blood flow is compromised. Now, this could be due to several reasons like cold temperatures, which can slow down circulation, or it might indicate a more serious condition such as dehydration or shock. However, capillary refill time can vary from person to person, and it can be influenced by external factors, so it's not the sole indicator of health. This thorough secondary assessment is essential for a complete understanding of the patient's condition, enabling effective communication with emergency medical services and facilitating appropriate medical intervention.